Okay, let's unpack this. We're taking a deep dive today into what's next for facial surgery. We're using the FaceInnovate 2025 symposium materials as our guide, really navigating the insights shared there.
Yeah, and it's more than just a conference report, right? It's about pulling out the, core knowledge, the trends shaping where things are actually going. We're drawing from what the leading experts presented.
Exactly. Our mission really is to cut through all the information and distill what's fundamentally driving change here. We're talking about that intersection of tech, how surgical teams work together, evolving really, and what it all means for training new surgeons.
And it's a broad scope we're covering, pulling from material on facial, craniomaxillofacial, or CMF and head and neck, H&N, surgery. The insights are aimed at, well, everyone involved, surgeons, trainees, but also those crucial allied fields.
Like prosthodontists, radiologists.
Oncologists, yeah,
Yeah.
all integral to patient care in this space.
So this analysis, this deep dive, it's really for you, the listener, whether you're deep in this field already or just curious about how these cutting-edge tools and new approaches are setting different standards for practice and, importantly, for patient outcomes in what is, let's face it, a really vital and complex area.
Definitely. And looking at the symposium material, it was very clearly structured. Two main pillars, really. Each day had a pretty distinct theme.
Right. Day one seemed to zero in on innovations and interdisciplinary integration. So new tools, new teamwork.
And then day two shifted gears, focused on reconstruction, how we measure outcomes, and critically, the future of surgical training.
The underlying goal you can see from the sources was practical insights, not just theory, showcasing technologies making an impact now and outlining some, pretty forward-thinking strategies.
Oh yeah, giving a tangible look at the horizon, and the steps needed to actually get there.
Okay, let's jump into day one then. Innovations and interdisciplinary integration. This feels like where the new really starts. Changing the toolkit, maybe expanding the idea of the team.
Precisely. The early sessions got right into it, surgical frontiers, technology and operative planning. And the focus wasn't just listing gadgets, it was about how these things are being assessed, how they're actually being integrated into surgery.
Okay, so that tech stack they mentioned, exoscopy, AMSJI, AI, XR, tissue engineering, robotics, big words. What specific insights came out about their impact right now?
What's really fascinating reading through it is the emphasis on tech enabling greater precision and personalization. Take AMSJI additive manufacturing for skeletal joint implants. That's not just like basic 3D printing. It's creating patient-specific implants from detailed digital plans. It fundamentally changes bone reconstruction.
From sort of best fit to custom built.
Exactly. Truly custom build. That was a key application, highlighted personalized bone reconstruction using 3D planning.
And exoscopy, what's that bringing?
Think enhanced visualization, a highly magnified high-def view, crucial for really delicate stuff like microsurgery in the head and neck. It just elevates what the surgeon can actually see and therefore what they can do.
Okay. And AI and XR were in the mix too. AI, artificial intelligence, XR, extended reality, like VR or AR for those maybe less familiar. How are they showing up here?
Right. The material pointed to AI and machine learning being used for surgical decision-making support, and particularly in digital planning for correcting complex facial deformities.
So AI isn't doing the cutting, but helping plan the cuts.
Precisely. Augmenting the planning. Analyzing data, seeing patterns, maybe suggesting optimal approaches based on, huge data sets. The source even mentioned specific GCC case studies showing real innovation there.
That's really interesting, thinking about how these digital tools change the whole planning phase. It sounds like it's moving beyond just the surgeon looking at scans,
It definitely raises important questions. How does the surgeon interact with these systems? It shifts planning from maybe purely experience-based to, data-enhanced and digitally simulated. It's a fascinating change in workflow.
And building on that evolution, here's where it gets really interesting for me. The team sport aspect. Day one heavily emphasized this interdisciplinary synergy. How are folks like prosthodontists or radiologists changing how facial surgeons work today?
What's fascinating there is they're not just consulted after the fact. They're being integrated right into the core planning and execution. The sessions highlighted dedicated discussions, for example, on prosthodontic approaches informing CMF reconstruction right from the start.
So thinking about teeth and function while playing the bone surgery.
Exactly, thinking about functional outcomes, future prostheses needs right then. And similarly, interventional radiology insights, crucial for complex blood vessel issues, or maybe finding minimally invasive options that could complement or even change the surgical plan.
So it's less handing off between specialists, more simultaneous collaboration,
Hmm.
especially in complex cancer cases.
That's the shift towards truly comprehensive care planning, leveraging all that expertise together. Other day one highlights they mentioned specific techniques like human-machine synergy in H&N surgery, how robots or computer-assisted systems work with the surgeon, and a deep dive into Superior Steel implants the evidence, best practices.
Okay.
Plus, there were some UAE-focused updates on surgical training showing regional progress, too.
And all this discussion, the tech, the teamwork, the techniques, it fed into an expert panel on day one, right? Covering complex cases, oncology, deformity, reconstruction. So what did the material suggest happens when the experts tackle real tough scenarios with these new approaches?
It really highlighted that shift from just potential to, well, actual practice and the
Yeah.
challenges that come up. Discussing complex cases forces you to look at how these technologies and collaborations really perform when things get messy, unpredictable. The insights shared were about navigating those real-world issues, finding solutions together.
Okay, let's shift to day two then. If day one was tools and teams, day two felt more about impact and the future. Reconstruction, outcome measures, future surgical training. That was the focus.
Yes, the morning sessions really honed in on reconstructive mastery and then outcomes and evaluation.
Okay, reconstructive mastery. So innovations in complex facial and H&N reconstruction. The material mentioned personalizing approaches, again, that theme, especially in major H&N surgery, and also advancements in TMJ replacement.
Yeah, critical areas, restoring function, form, after trauma, disease, or correcting congenital problems. Personalizing approaches, especially when dealing with major H&N defects, means moving beyond standard techniques. It means tailoring the reconstruction to that specific patient's defect and needs, often using things like the 3D printing, the AMSJI we talked about.
And TMJ, the jaw joint.
Vital for movement, quality of life. So advancements there have a huge patient impact.
And absolutely crucial to knowing if any of this works, measuring outcomes. The symposium seemed to really focus on this, both clinical outcomes and patient-reported outcome measures, PROMs.
Understanding outcomes is just fundamental. Clinical results give us objective data. Sure, did the graft take? Did the wound heal? But integrating PROMs, what the patient actually experiences, function, pain, how they feel about the appearance, their overall quality of life, that's increasingly seen as non-negotiable.
Right.
And it raises a key question the material tackled. How do we reliably capture and use that patient perspective to define success? It's not always straightforward.
The source mentioned specific examples like evaluating outcomes after cancer surgery or success metrics in orthognathic surgery, jaw correction.
Yes, showing success isn't just about the surgical technique itself, it's the whole impact.
Yeah.
And really importantly, the material highlighted learning from complications,
Yes.
discussing systems for reporting them, but also for prevention, moving beyond just finding errors to making systemic changes so they don't happen again.
That sounds like a really mature approach to quality improvement.
It's a significant step.
Okay, so with all this tech, integrated teams, complex outcomes, how do you train surgeons for this future? Let's unpack that training angle from day two, next generation surgical education. What's changing there?
That was a major theme, definitely. Looking at training models, UK, US, UAE examples were discussed. And what's fascinating is how tech is integrated not just into surgery, but into learning surgery. The material specifically mentioned the UK VRIMS program. That's a VR/XR, virtual or extended reality training model.
So simulation, VR, AR, these are becoming standard tools for learning now, not just optional extras.
They're certainly moving fast in that direction. The discussions covered innovations in oral and maxillofacial surgery training in the UK and US, focusing on the future of, well, selection, who gets into training, simulation, and assessment.
Simulation makes sense. Safe practice.
Right. Repeatable practice for complex procedures. VR/XR offers these incredibly immersive environments, mimicking real scenarios, even with haptic feedback sometimes. But a key nugget here is these aren't just add-ons. They're starting to influence who gets selected and how competence is actually measured before trainees even get near a real patient.
Wow. That sounds like a really fundamental shift, changing how surgical skill is even defined and built.
It truly is. Preparing surgeons for the future toolkit, the future team dynamics. It needs a different approach to education than just, the traditional apprenticeship model.
And all these threads, tech, teams, outcomes, training, they seem to converge in the final sessions. Leading surgeons sharing their vision for the next decade, and a closing panel on building a global roadmap.
Yeah, if you connect it all to the bigger picture, the material clearly shows a field being really proactive, addressing these huge shifts from tech and collaboration head on. And that idea of a global roadmap, it suggests a collective effort, standardizing things, sharing best practices, aligning training internationally.
Okay, let's try and synthesize the value proposition here. From the source material, why do these insights from FaceInnovate 2025 matter to you, the listener?
Well, I think it's about understanding the real changes happening now, learning from global leaders about how new tech is actually being used, getting a handle on the specific tools and trends impacting care, recognizing how crucial networking and deep collaboration are becoming.
With peers, with allied fields.
Exactly. And seeing how all these forces are reshaping surgical education, it's about staying current.
Ultimately, it all comes back to elevating patient care, right? And professional development in a field that's just incredibly specialized and evolving fast.
It really is a field in rapid evolution. The pace highlighted is significant.
So, to wrap up the key takeaways from this deep dive, drawing from that FaceInnovate 2025 material, first, the critical practical role of technology. Tools like AMS-JI for custom implants, exoscopy for precision, AI for planning support, XR for training. They're not just concepts. They're being assessed, integrated now.
Absolutely. And tied directly to that is the necessity of interdisciplinary collaboration. It's becoming fundamental. Surgery here is increasingly a team sport. Prosthodontists, radiologists, oncologists involved right from the beginning.
We also saw that significant focus on measuring outcomes rigorously. Not just clinical results, but crucially, patient perspectives via PROMs. And that proactive approach, learning from complications through systematic reporting and prevention.
And underpinning all of it is that transformation in training, how surgeons are taught, evaluated, simulation, VRXR models are fundamentally altering the path to expertise.
It really feels like the symposium material offered this comprehensive view, from the microspecific tools and techniques to the macro global roadmaps, integrated teams. Not just a showcase, but a strategic look ahead.
A field actively trying to shape its own future in response to innovation. Yeah.
So as a final thought for you, the listener, to maybe mull over, consider how this rapid integration of AI, robotics, XR, combined with the heavy emphasis on teamwork and patient outcomes. How might that redefine the skills and knowledge needed in any high-tech specialized field, not just surgery, any field facing similar rapid change, complex problems? How does this transformation reflect broader shifts you might be seeing or anticipating elsewhere?
It's a compelling question, almost a blueprint for the future of expertise itself, perhaps.
Definitely something to think about. Thanks for joining us for this deep dive.
Until next time.